Hello and welcome to our 2025 open enrollment presentation for our University of California retirees. Today's presentation is presented by the UCLA Healthcare Facilitator Program, Erica Castillo and Deborah Wells. Today we'll go over open enrollment overview, UC Medicare requirements, medical plan changes, the non-medical plan changes, how to make changes, and then some tools and resources and how to get help. Open enrollment materials. Our open enrollment booklets were mailed the week of October 24th. The university pulled mailing addresses that were on file as of September 20th of this year. If you moved or changed your address after this date, you will need to log on to UCNet to view the booklet online. The first booklet on the left was mailed to UCLA faculty and staff who are still actively working. The booklet in the middle was mailed to UCLA retirees living in California and also retirees living outside of California if you have a family member that is not eligible for Medicare. The booklet on the far right was mailed to our UCLA retirees living in a state outside of California, and all family members are enrolled in Medicare. Even though you may decide to not make any plan changes, we highly suggest that you review the booklet, compare the plans and premiums for next year. Although your plan may not have many changes, your premium may change, or you may discover that your plan has included some new resources or enhanced benefits. As a retiree, your booklet has a special number printed above your name on the envelope. This number signifies or indicates the maximum amount UC will contribute toward your medical and dental premium. If you have a 100 listed above your name, the premiums listed in the booklet apply to you. If you have anything less than 100, the premiums listed do not apply to you. You will have to log into UC Raise to find the premium for yourself and your family members for next year. Please note that the deadline this year is November 22nd at 5:00 p.m. Pacific Standard Time. If you need to make any open enrollment changes, they must be made by this deadline. You may have seen commercials on television or have received information in the mail regarding Medicare's open enrollment October 15th through December 7th. Please do not get these deadlines confused. Be sure to pay attention to UC's deadlines since UC controls your health plan enrollment. We'd also like to point out that there are no pre-existing exclusions on any of our UC plans. This changed as part of the Affordable Care Act legislation. So what happens if you do nothing? If you are satisfied with your current health plans and you don't want to make any open enrollment changes, your current plan selections will automatically continue for next year. Open enrollment is the time to consider your options for next year. Are you satisfied with your current medical and dental plan? Have you recently married or need to add or remove a family member? Are you aging into Medicare next year? Have your health needs changed or do you need more flexibility? Did you previously suspend your UC health plan and now you need to unsuspend? This is the time to consider those changes. Retiree premiums. The medical plan premiums are listed in your booklet. Again, the premiums listed are for retirees eligible for 100% of the maximum UC contribution. Many retirees want to know if they are eligible for the Medicare Part B reimbursement. A retiree is eligible for the Medicare Part B reimbursement only if their premium is zero. If you are eligible for a Medicare Part B reimbursement, you will see a credit each month in your pension income. See the plan cost key. The top number in bold is what you will pay. The number below is the Medicare Part B reimbursement. If you are currently receiving a Part B reimbursement, review the premiums for next year to see if your reimbursement will be more or less for next year. Throughout the year, we often receive calls from retirees needing to understand their deductions. If you take a look at your pay stub, you will see a description of your deductions similar to this. When you see MED, that's medical. MBR, that means member. PREM, that's premium. So this is medical member premium. Member is the retiree. This is what the retiree premium will be. DEN is dental. So this is the dental member premium. When you see ER, that's employer. That's the university. So if you see MED, ER, PREM, med, employer, premium, that's what the university is contributing towards your medical premium. And then the dental employer premium. This is what the university is contributing towards your dental plan. And then if you see a Medicare reimbursement, that will be listed also on your pension statement if you're entitled to a reimbursement. Here are the premiums for next year for our non-Medicare retirees. These are the rates for retirees enrolled in Medicare, and all covered dependents are also enrolled in Medicare. As you will notice, only the Kaiser Senior Advantage and the UC Medicare PPO without prescription drug coverage are the only two plans that are offering a Medicare Part B reimbursement for next year. The UC Medicare Choice, UC Medicare PPO, and high option plans do not have a Part B reimbursement. And that's because the cost of these plans are higher than the UC contribution, and therefore you'll pay the difference in the premium. These are the rates for retirees who are over the age of 65, but are not eligible for Medicare. And these are the rates for retirees with a split or mixed family. A split or mixed family means some family members are enrolled in Medicare Part A and Part B, and other family members are not enrolled in Medicare. If you want to know what your plan premium will be for next year, you want to log in to UC Raise so it can pull the premium that you will pay for next year. You can also use the Retiree Premium Estimator tool found on our Healthcare Facilitator page. When you log onto our HCF page, click on the link and download the Excel spreadsheet. Save it on your desktop, go to your downloads, and then follow the instructions. UC Medicare requirements. Are you or a covered family member aging into Medicare next year? Here's a frequently asked question we receive at this time of year. I'm enrolling in a Medicare plan next year. Are there any resources to help me understand my choices and what I need to do? The answer is yes. UC offers many helpful resources, including the Medicare fact sheet, the Medicare frequently asked questions, and Medicare office hours and webinars where you can speak with someone live and in person. For more information about these resources, see what to do when you're enrolling in Medicare at ucal.us/Medicare. Medicare enrollment is mandatory for all retirees and their family members if you are eligible for premium-free Medicare Part A. If Medicare Part A is premium-free for you, you must enroll in Medicare Part B. UC relies on Medicare to offset the cost of insurance. Retirees over the age of 65 without Medicare costs twice as much to insure or more. Medicare partially reduces the cost, which keeps the UC premiums affordable, which allows the university to continue to fund health benefits for retirees. To enroll in a UC-sponsored Medicare plan, your Medicare ID card must reflect both Part A and Part B. Failure to comply may result in penalties and permanent loss of UC-sponsored medical coverage. There is an exception, and that's for those who retired prior to July 1st, 1991, and retirees who live outside of the United States. Just keep in mind, if you decide not to enroll in Medicare because you're living abroad, you must remember if you move back to the United States, UC will require you to enroll in Medicare at that time. And at that time, you may be subject to a Medicare late enrollment penalty. The penalty is assessed by Social Security, not the university. Everything you need to know can be found in the Medicare fact sheet that's located on UCNet. Once you are retired, if you have some family members eligible for Medicare and some family members who are not currently eligible for Medicare, you're considered a split or mixed family. The non-Medicare family members will be in the non-Medicare plan, and the Medicare family members will be in the Medicare plan. The retiree is the driver of the medical plan. If the retiree is in UC Blue and Gold, the Medicare family member must complete the UBIN 121 form when they become eligible for Medicare, and then they will move over to the UC Medicare Choice PPO plan, which is administered by United Healthcare. If the retiree is enrolled in Kaiser Permanente, when a family member or the retiree ages into Medicare, they'll complete the UBIN 127 form, and then that Medicare family member will move into Kaiser Senior Advantage. If you're in the core or UC Care plan, as you age into Medicare, you'll complete the UBIN 123 form, and then you'll move into the UC Medicare PPO plan. If you happen to have already been enrolled in the UC Health Savings Plan while you were still actively working, and you carried this plan into retirement, when you or a family member becomes eligible for Medicare, you must come out of this plan. It is not compatible with Medicare, any parts of Medicare. So again, if you're aging into Medicare, you will need to complete the UBIN 100 form and also the UBIN prescription drug form, depending on which plan you decide to enroll in for your family. And then you'll submit those forms to the RASC. Here are the Medicare premiums for 2024. At the time this presentation is being recorded, the 2025 premiums have not been released. So just keep in mind that if you're aging into Medicare next year, the premiums may be different for you. Now, most of us have paid into Social Security and we have earned Medicare Part A for free. When it comes to Medicare Part B, everyone will pay a premium. You will pay this premium in addition to your UC premium, if applicable. If you're collecting Social Security income, it will automatically come out of your Social Security check each month. If you decide to delay collecting your Social Security benefit, you will be billed quarterly, or you can enroll in Medicare Easy Pay. Easy Pay is a free service and it will allow you to set up monthly reoccurring payments from your checking or savings account. Please note, if you are higher income, you may also be charged a separate Part D premium, also called IRMA. Some individuals do not qualify for Medicare because they did not pay into Social Security or they did not earn the benefit under their own work record. But if you are currently married and you did not pay into Social Security nor earned your own 40 credits elsewhere, you could qualify under your current spouse. Your current spouse may have enough credits for you to have earned Medicare. And you become eligible under that spouse when they age 62. Now, if you're currently single but was previously married at least 10 years, you may qualify under your former spouse if they are eligible for Social Security benefits. And again, that's at age 62. I'm highlighting 62 because many of our retirees have forgotten that they became eligible when their spouse or former spouse age 62, and they did not apply until they became age 65, and now they're 3 years late, and now they will be assessed a 3-year penalty by Social Security. It's very important for you to know the facts about Medicare and what UC requires of you so that you are not penalized later. If you age into Medicare after you retire, UC will send you instructions about Medicare approximately 2 months before your or your dependent's 65th birthday. The instructions will tell you when to enroll and how to enroll in Medicare. In this example, I'm giving you an example of a retiree that's aging 65 in the month of April. So they will receive their packet 2 months, February, prior to their 65th birthday. They will have 60 days to contact Social Security, apply for Medicare Part A and B, complete the required UBEN prescription drug form, and then submit it to the university, the RASC. Now, in the birthday month of April, that form should have been received by your 65th birthday month. The very next month, if you have not submitted the required form, the university is going to start penalizing you $419.60 every single month, in addition to the commercial premium that you're already paying, until you get the form completed and submit it to the RASC. After the 3 months, you run the risk of being terminated from your UC retiree medical plan. Now, if you are not eligible for Medicare, you need to request a denial letter from Social Security and submit it to the RASC so they know that you're not eligible. Medical plan overview. The medical plans offered this year will be the same for next year. For our non-Medicare plans, we have the PPO plans administered by Anthem Blue Cross, UC Care, Core, and the UC Health Savings Plan. Now, the UC Health Savings Plan is not open for new enrollment for retirees. Again, you would have had to already been enrolled in this plan as an employee, active employee, and continued into retirement. And then we have our UC Blue and Gold plan administered by HealthNet. And then we have Kaiser Permanente. Our Medicare plans are UC Medicare PPO, the UC Medicare PPO without prescription drugs, and the UC High Option. We have Kaiser Senior Advantage, UC Medicare Choice administered by United Healthcare, and then we have VIA benefits for those retirees living outside of the state of California. And then for next year, our same dental plans, Delta Dental PPO and Delta Care USA, VSP, the legal plan, and our Prudential Life AD&D, and then our pet insurance by Nationwide. Depending on where you live will determine your options for next year. Plans listed in black print are the non-Medicare plans, and plans listed in the red print are your Medicare plans. I will point out, though, that if you live abroad or move abroad, the only two plan options available are UC Care and Core. And that's because Medicare does not cover services outside of the United States. If you want to know which medical plans are available in your area, use the Plan Availability tool. And here's the link, and it's also found on our HCF page. The Kaiser Senior Advantage Plan is not offered in the San Luis Obispo area, zip code 93401. So if you're currently enrolled in Kaiser and you're aging into Medicare and you live in this area, you are not going to be able to continue your coverage in Kaiser. You'll have to select either UC Medicare Choice, the UC Medicare PPO, or High Option. Now let's talk about our HMO plan changes. UC Blue and Gold. Our UC Blue and Gold plan is administered by HealthNet. Here's a side-by-side comparison on the changes for next year for our UC Blue and Gold members. We have highlighted in red print the changes for next year. You will see the office visits for specialists and also urgent care is changing from $20 to $30. The inpatient copay remains the same. Outpatient surgery copay remains the same. And the emergency room copay remains the same. When it comes to our prescription drug copays, those are changing. The 30-day retail is going from $5 to $10. Brand, $25 is going up to $30. And the non-formulary copay is going from $40 to $50 for a 30-day supply. If you get a mail order, you'll get a 90-day supply for $20 if it's generic, $60 if it's brand, or $100 for non-formulary. Our specialty drugs will be a 30% coinsurance up to a maximum of $150. If you have any injectables administered in the doctor's office, the copay will be $30. Our behavioral health copay is changing from $20 to $30. The hearing aid benefit is remaining the same. Acupuncture and chiropractic services remain the same. You'll still have telehealth services also. Minute Clinic, the copay is changing from $20 to $30. And doula services, now this is a new benefit. The doula services will be covered with no copay for 11 visits per pregnancy. The member will pay the full cost of services after the 11th visit. The physician medical groups, you will still be able to access UCLA health providers or any provider that's listed in the UC Blue and Gold network. The annual out-of-pocket maximum will remain the same, $1,000 for an individual or $3,000 for a family of 3 or more. Now we'll go over Kaiser Permanente. Here is a side-by-side comparison for the changes for next year for our Kaiser members, our non-Medicare Kaiser members. We have highlighted again in red the changes for next year. The office visit copay is going up $10, it'll be $30. The inpatient and ER copays remain the same. The Optum Behavioral Health Emergency Room copay is increasing from $75 to $125. The prescription drug copays are listed here. Generic will be $10, brand $30 for a 30-day supply. The generic for a 31 to 60-day supply will be $20 and brand $60. For a 61 to 100-day supply, generic will be $30 and brand $90. And then the mail order, generic will be $10, brand $30. And then for a 90-day supply by mail order, generic will be $20, brand $60. The specialty drug copay will go to 30% coinsurance up to $150. For Kaiser members, they will also be offered the new benefit next year, doula services, covered with no copay for the first 11 visits. After the 11th visit, you will then pay the full cost. For behavioral health, Kaiser behavioral health visits will go to a $30 copay for an individual and a $15 copay for group visits. For Optum behavioral health visits, 1 through 3 will remain at a $0 copay, but once you reach the 4th visit, you will then pay a $30 copay. The My Strength app, if you're using this app, it will be discontinued after December 31st. The hearing aid benefit will remain the same, $1,000 allowance. Acupuncture will remain the same. The out-of-pocket will remain the same, and you'll still have services through Target clinics. Kaiser Permanente Senior Advantage. Here's a side-by-side comparison for the changes for next year for our Kaiser Senior Advantage members. The office visit copay is going up $10 to $30. The prescription drug benefits are the same as the Kaiser non-Medicare members. So I have the copays listed here. Again, they're the same. The eyeglass benefit will remain the same. For our Kaiser Senior Advantage members, they have a $150 allowance for eyeglasses, contact lens, and frames. The Kaiser Senior Advantage plan is the only retiree plan that offers a vision benefit. So if you are enrolled in a UC plan other than Kaiser Senior Advantage, you may want to consider enrolling in VSP. Some Kaiser members decide to enroll in VSP in addition to their Kaiser vision benefit, and they have 2 vision plans. It's up to you if you need that much vision coverage. For Kaiser Behavioral Health, Kaiser Senior Advantage does not have Optum behavioral health coverage. That benefit goes away once you become eligible for Medicare. The office visit copay will go from $20 to $30, and the group copay will be $15. New next year is a fitness benefit. One Pass membership will be added, offering access to fitness gyms, home fitness kits, and much more. The hearing aid benefit is $2,500, the same as this year, will be the same for next year. Acupuncture and chiropractic service copays remain the same. Out-of-pocket remains the same for the medical and behavioral health at $15 each, $3,000 for a family. But the prescription out-of-pocket maximum is actually going down quite a bit. It's going down for all Medicare plans. So it's going from $8,000 down to $2,000. So once you reach $2,000 out of pocket, your prescription copays will be paid in full. Kaiser Senior Advantage members will continue to have Target Clinic services benefit as well for next year. If you're enrolled in Kaiser Permanente or Kaiser Senior Advantage next year, and you're planning a trip out of the area or may have a child going away to college, make sure you contact Kaiser's Away from Home Travel Services, a visiting member program at 1-951-268-3900. They're available 24/7. Kaiser offers so many other options for services in other states while you're visiting or traveling out of the area. If you're planning to enroll in Kaiser next year, you can call their pre-enrollment telephone number at 1-800-324-9208, Monday through Friday, 7 a.m. to 6 p.m. for assistance. You may also scan this Kaiser QR code to schedule a virtual appointment. Appointments are also available in Spanish. Now let's talk about the PPO plan changes. Accolade will continue as Anthem's first point of contact. Accolade will provide the utilization management, provider services, and clinical support for our non-Medicare plans, which is UC Care, the UC Health Savings Plan, and CORE. In addition to providing customer service, they offer clinical support, virtual care, and can assist you with understanding a diagnosis. Next year, virtual second opinions will be offered through Second MD for virtual primary care and behavioral health therapy services. For more information, contact Accolade at 866-406-1185 or log on to their member portal. Now let's talk about our first PPO plan, CORE. CORE is administered by Anthem Blue Cross. The CORE medical plan is a non-Medicare PPO plan with worldwide coverage. The calendar year deductible remains at $3,000. Preventive services are covered in full and not subject to the calendar year deductible. In the past, CORE was offered at a zero premium. Next year, all CORE members will have to pay a premium. Our next PPO plan is UC Care, administered by Anthem Blue Cross. As you know, UC Care consists of 3 tiers. Your out-of-pocket cost depends on where your services are rendered. If you have services in Tier 1 or UC Select tier, that's for services by a UC provider. For example, when you have services at UCLA Health or UC San Diego or UC Irvine, UC San Francisco, or UC Davis, any UC facility, if it's in the Tier 1 benefit, you will pay Tier 1 copays. If you go outside of the UC system, but you see someone who is in network, meaning they're contracted or Anthem's preferred provider, you will have a $500 copay, $500 deductible, and then you'll pay coinsurance accordingly. If you go outside of the UC system and you do not find a preferred provider, a contracted provider of Anthem, you're considered out of network and your deductible is $750, and then you'll pay the coinsurance accordingly. You'll see highlighted in red the changes for next year. For our Tier 1 UC Select, office visit copays are going from $20 to $30, and urgent care will also go up to $30. For in-network, Tier 2, office visits for behavioral health, visits 1 through 3 for behavioral health visits will remain at a zero copay, but 4 visits and more will have a $30 copay. The deductible does not apply. The urgent care will have a $30 copay, no deductible applicable if you're with a in-network or contracted Anthem urgent care facility. The prescription copays are listed here in red for the changes for next year. For a 30-day supply, for retail 30-day supply, copay will be $10 for generic, $30 for brand, and $50 for non-formulary. If you get a 90-day supply or mail order supply, you'll pay $20 for generic, $60 for brand, and $100 for non-formulary. For telehealth services, there is a change for Live Health Online. It's available 24/7. If you have a medical or psychology or psychiatrist service, the copay will be $30. The out-of-pocket maximums remain the same for next year. When you have services in our Tier 1 UC Select tier, you want to make sure you see the evidence of coverage booklet, the EOC. The EOC will list all limitations, exclusions, and services that are not available in the UC Select tier. Sometimes multiple co-payments can apply per service. For the out-of-network Tier 3, some out-of-network services have maximum payment limits. So you want to know, even though the coinsurance is listed here, you want to make sure whatever services you're receiving, it doesn't have a maximum payment limit. Again, everything you need to know can be found in our evidence of coverage booklets available on UCNet. And then we have our UC Health Savings Plan, our HSP plan, also administered by Anthem Blue Cross. The UC Health Savings Plan, again, is not open for new enrollment. We have highlighted in red print the changes for next year. The UC Health Savings Plan is a high deductible PPO plan. You nor any of your covered family members can have any parts of Medicare. They cannot have Medicare Part A and they cannot have Medicare Part B. The coverage is within the United States. If you're traveling abroad, you are covered for anything urgent or emergent. The UC Health Savings Account, the HSA, will continue to be administered by Health Equity next year. So what's changing? Again, it's listed in red. The in-network deductible is going up to $1,650. The family in-network deductible is going up to $3,300. There are no changes to the out-of-network deductible. It will remain at $2,600 for self-only coverage and $5,200 for family coverage. The maximum health savings account contribution for individual is increasing to $4,300, and the family maximum for the health savings account is increasing to $8,550. If you're age 55 or older, the $1,000 catch-up contribution will remain the same for next year. The same one-time UC contribution towards your health savings account, your HSA, will be given to you on January 1st. So if you enrolled in the UC Health Savings Plan, an individual self-only coverage, you'll receive $500 from the university into your HSA. And if you have a family, you'll receive $1,000 in your HSA. You'll see that on January 1st. The copay for Accolade Care telehealth and virtual visits, it will increase from a $0 copay for the first 12 visits to $30 copay for all visits. If you're aging into Medicare next year, keep in mind during this open enrollment that you will need to make changes next year if you or your family member will become eligible for Medicare. Medicare PPO plan changes. Our UC Medicare Choice is administered by United Healthcare. It's an Advantage PPO plan. Listed here in red are the plan changes for next year. The office visit copays are going from $20 to $30. The inpatient, outpatient, and ER copays will remain the same. The prescription drug copays are going up. For retail, 30-day supply, generic is going to be $10 copay, brand $30 copay, and non-formulary $45 copay. If you receive mail order 90-day supply, it will be a $20 copay for generic, $60 for brand, and $90 for non-formulary. The specialty drugs will be 30-day supply, $30. For 90-day supply, it's not applicable. The 90-day supply at UC pharmacies, you'll only have to pay 2 copays. The behavioral health office visit will be a $30 copay as long as you see a United Healthcare or any licensed provider. The hearing aid benefit will remain the same at $2,000. Acupuncture services, the copay is increasing from $20 to $30. Chiropractic services, the copay will remain at $20. Telehealth services, there is a change for the 24/7 clinical support. It's changing from 24/7 nurse support to 24/7 doctor access. When you access services through Amwell, Doctor on Demand, or Teladoc. New next year for the UC Medicare Choice members is the fitness program. Renew Active is going away and it's being replaced with silver sneakers. There is no cost for fitness clubs. Other services are listed here: the post-hospital discharge meals and transportation, and the personal emergency response system by Lifeline will continue. Because this is an Advantage PPO plan, it's open access. You can see any provider you want. Within UCLA, outside of UCLA, UCSD, UC Davis, Mayo Clinic, out of state. The only thing you want to remember is to always use Medicare providers, and they must bill your United Healthcare plan, and many providers will. If you happen to be traveling or visiting abroad, you can continue your enrollment in this plan up to 6 months. If you find that you're still going to be abroad going into that seventh month, you need to contact the RASC and enroll in another plan. The annual out-of-pocket will remain the same for medical services at $1,500 each, or $3,000 for the family. And the prescription out-of-pocket maximum, it will remain at $2,000, and the troop out-of-pocket maximum is going from $8,000 down to $2,000. So you're really not going to see any difference in the prescription drug maximum if you're already in this plan. One thing that I want to point out is if you're already enrolled in this plan and you're one that has a zero premium now and you have a Medicare Part B reimbursement that you're receiving right now, the Medicare Part B reimbursements are going away for these plan members. The UC Medicare Choice plan will no longer have a zero premium. UC Medicare PPO is administered by Anthem Blue Cross. If you enroll in the UC Medicare PPO plan next year, your Medicare plan will be primary and your Anthem Blue Cross will be secondary. Listed here are the plan changes that are in red print. You'll notice that there are not many changes. Other than the prescription benefit, all services remain the same. The copays for a 30-day supply is going up to $15 for generic and $30 if you get a 90-day supply. The preferred brand will be $35 for a 30-day supply or $70 for a 90-day supply. And the non-preferred will be a $50 copay for a 30-day supply or $100 for a 90-day supply. Again, there's no coverage for vision benefits, the eyeglass wear for the UC Medicare PPO plan members. So you would want to consider enrolling in VSP if you need vision coverage. The hearing aid benefit, acupuncture benefit will all remain the same. The annual out-of-pocket maximum will remain the same at $1,500 for medical services. The prescription out-of-pocket maximum is decreasing from $8,000 to $2,000. Like Health Online will continue next year through for your telehealth services. This plan also offers worldwide coverage up to 6 months. If you're outside of the country for 6 months or more, again, you must contact the RAS to enroll in either UC Care or CORE. Please note that if you are in a UC Medicare plan, you must use Medicare approved providers. The only exception is if you're having acupuncture services, hearing aids, or behavioral health services. If you have services with any licensed provider, behavioral health provider, including psychiatrists, psychologists, or marriage and family therapists, you don't have to necessarily find a Medicare provider. You can continue to see the same provider you're treating with now. Just contact the plan if you have any issues seeing your behavioral health providers or accessing services. UC High Option, also administered by Anthem Blue Cross. If you enroll in the UC High Option Supplement Plan for next year, Medicare will be primary and Anthem Blue Cross will be secondary. When you're enrolled in the High Option Plan, between Medicare and your Anthem Blue Cross Supplement Plan, most services are covered at 100%. And I say most services, not all services. The UC High Option Supplement Plan will have changes to the prescription benefit for next year, but you'll notice all other services will remain the same. UC Medicare PPO without prescription drug plan. The plan has no plan changes for next year. The deductibles remain the same and all the inpatient and office visits. The eyeglass, there's no benefit and it won't be a benefit next year. So if you're enrolled in this plan, you want to consider enrolling in VSP if you need vision benefits. The hearing aid benefit will remain the same. Acupuncture and the out-of-pocket maximum all remain the same. Again, if you're in a Medicare, UC Medicare plan, you must use Medicare approved providers. Member ID cards. You may not think about your health plan ID card until your doctor or your provider asks you for the information. The appropriate ID card must be presented to obtain benefits or services. Every year, you should make it a point to find out if your plan will be issuing new ID cards. Over the years, I have found that many of our members are carrying the wrong health plan ID card or no ID card at all. You can prevent being denied services by simply presenting the most updated ID card to your providers. All ID cards should be received by the first of the year. If you do not receive your ID card, contact the plan directly. Now let's go over VIA Benefits, UC's Medicare Coordinator Program. If you're a retiree living in a state outside of California and all of your family members are also enrolled in Medicare, you should have received this booklet on the far right. Your open enrollment dates and instructions are different than retirees living in California. If you haven't received your open enrollment booklet, log on to UC Raise and verify the address is correct that we have on file for you. VIA Benefits is UC's Medicare Coordinator Program. This VIA Benefits program offers more choices for those living outside of the state of California, more value and flexibility. You also have support services through VIA Benefits. When you contact VIA Benefits, they will help you get enrolled into a Medicare supplement plan and a Medicare prescription drug plan. Depending on how many years of service you work for the university will determine the HRA contribution that you will receive by the university. UC will provide an annual contribution for each covered family member under the health reimbursement account. Each covered family member will choose an individual plan that's best for them. You can each be in your own individual plan. You'll use the HRA dollars to pay for your Medicare supplement plan. You can also reimburse yourself for your Medicare Part B reimbursement and Part D premiums, as well as pay for some out-of-pocket expenses like your prescription or office visit copays. During open enrollment, retirees must submit a paper form if you need to enroll or change your dental, vision, or legal plan, or add family members to your plan. For more information about VIA Benefits, log on to their website or contact the Solution Center at area code 855-359-7381. Now let's go over the non-medical plan changes for next year. For our dental plans, Delta Dental PPO and Delta Care USA will continue for next year. They're both administered by Delta Dental. UC pays 100% of the monthly premium for retirees who are eligible for the UC contribution. Again, if you have a 100 above your name on your open enrollment mailer. If you have anything less than 100, you need to log into UC Raise to find out what your premium will be for next year. If you are currently enrolled, your coverage will continue for next year. If you're not enrolled in the dental plan, now is the time to consider enrolling. For our vision plan, VSP will continue as the vendor. There are no benefit changes. There will be a premium increase of 5%. I have the premiums listed here, comparing the 2024 premiums to next year's 2025 premiums. If you need to enroll in VSP, make sure you don't miss the deadline of November 22nd at 5:00 p.m. When you enroll in VSP, you're going to make your payment arrangements directly with VSP. The university doesn't contribute to the vision plan. You pay the full premium on your own. If you're currently enrolled in VSP, your coverage will automatically continue for next year as long as you continue to pay your premium. VSP is open for enrollment. To enroll, you can click this link to enroll online or call them at 866-240-8344. For the legal plan, ARAG will continue as the provider for next year. There are no benefit changes. The premiums will remain the same, listed in the upper right-hand corner. The premiums are deducted from the retiree's monthly pension check. If you're currently enrolled, your coverage will automatically continue. If you're not enrolled, it is open for enrollment. Accidental death and dismemberment, AD&D. Prudential Life continues as AD&D insurance provider. There are no benefit changes. There is no UC contribution. You will make payment arrangements directly with Prudential. If you're currently enrolled, your coverage will automatically continue as long as you continue to pay your premium. You have two options to enroll. You can call 1-800-524-0542 or log on to UCNet and download the form. The AD&D is always open for enrollment throughout the entire year. For pet insurance, Nationwide continues to be the vendor for our pet insurance. It's an exclusive plan with preferred pricing just for the University of California. They do offer coverage for your cats, dogs, birds, small mammal, and exotic pets. Your livestock is excluded, like your horses or cows. The rates are based on the species of animal and the state that you live in. There is no UC contribution. You'll make payment arrangements directly with Nationwide. If you're currently enrolled, your coverage will automatically continue as long as you continue to pay your premium. If you're not enrolled, it's always open for enrollment throughout the entire year. If you need to enroll your pets, just log on to this website listed in the upper right-hand corner or call 1-877-738-7874. So let's talk about how to make changes. If you need to make changes, you need to log into UC Raise. That's the best way to make sure that your changes are made and confirmed. When you log into UC Raise, it'll walk you through the instructions. Make sure you look for the button that says confirm. I believe you have to make 2 clicks to confirm your selections and make sure you receive a confirmation number. If you don't have a computer or you're locked out of UC Raise, you always have the option to contact UC Raise or the RASC at 1-800-888-8267 Monday through Friday from 7 a.m. to 4:30 p.m. You can also submit a paper form, the UBEN 100 form, but your forms and selections changes must be done by November 22nd, 5:00 p.m. If you're changing to a new Medicare plan next year, you want to make sure that you complete the prescription drug form for that Medicare plan. So if you're enrolling in Anthem Blue Cross, you need to complete the UBEN 123 form. The Kaiser Senior Advantage plan, if you're enrolling in this plan, you'll complete the UBEN 127 form. If you're enrolling in the UC Medicare Choice PPO plan, you'll use the UBEN 121 form. All of your forms must be received by the RASC by the deadline. You can fax your form to 792-5178 or mail your forms to the RASC at P.O. Box 24570, Oakland, California, 94623. Your mailed forms must be postmarked by the deadline. If you are a retiree or survivor enrolled in a UC medical plan and either you or a covered family member is enrolled in a UC sponsored plan and want to cancel or suspend your UC plan, you must complete the UBEN 101 form. If you disenroll or cancel your Medicare plan, if you suspend your medical plan, or if you disenroll from a Medicare plan and enroll in a UC Medicare PPO without prescription drug plan. This is the only time this UBEN 101 form is necessary. If you have any questions, you can always call the RASC at 1-800-888-8267 or contact your local healthcare facilitator. When you have a qualifying event outside of open enrollment, keep in mind you have the option to make changes to your plans. So if you move outside of the plan service area, or you have an involuntary loss of coverage, or you get married, have a new dependent, that is a qualifying event. It's a life event, and you have 31 days from that life event date to enroll or make changes to your plans. UCLA health providers. During open enrollment, if you would like to have access to UCLA health providers by enrolling in UC Blue and Gold, Core, UC Medicare PPO, High Option, or UC Medicare Choice, you will have access to UCLA primary care and specialty care services. If you need help finding a doctor who's right for you, contact UCLA Health at area code 310-825-2631, Monday through Friday, 7 a.m. to 7 p.m. The Healthcare Facilitator Program. The UCLA Healthcare Facilitator Program, or HCF program, assists employees and retirees for the University of California. We serve over 56,000 active and over 17,000 retired faculty and staff, as well as your survivors and any covered family member. Before you contact your healthcare facilitator, we ask that you be your own advocate as much as possible before contacting us because we serve such a large population. So some of the things you can do before you contact us is take the time to understand your benefits. Log on to UCNet. The link is here. Review your evidence of coverage booklet. Look at what the limitations or exclusions are. Check out the formulary. See if there's anything that's limited or excluded from your plan. You can also contact your medical plan. Your plan can answer questions about your coverage, about authorization requirements, finding providers, in-network providers. They can also assist with second opinions or pharmacy-related issues. They can also help you change your primary care physician or find a primary care physician. You can also contact your provider's office or the billing office. If you receive a bill, the first thing you need to do is call the provider, call the number on the bill, make sure they have the most updated insurance information and that they have billed your plan. After you have already tried to resolve the issue on your own, and you've already reached out to the plan or the provider's office and you still need assistance, then yes, you need to contact your healthcare facilitator program. Erica Castillo handles employees and retirees with last names A through K. And myself, Deborah Wells, I serve employees and retirees with last names L through Z. Our contact information is listed here. Our preferred way for you to reach us is through our email, hcfhelp@chr.ucla.edu. This is the mailbox that we try to monitor and get back to you as quickly as possible. So for some tools and resources, listed here on this page are resources you may find helpful. We have also included the steps retirees should use when you're ready to review your open enrollment information. Everything you need to know about UC health and welfare benefits can be found on UCNet, like your annual open enrollment information, evidence of coverage booklets, and fact sheets. If you need to contact the RAS, we have listed their phone number here. We have also listed CMS, Social Security, and HICAP. When it comes to Medicare and Social Security benefits and information, these are the experts to address those questions. If you have a question after reviewing this presentation, we invite you to attend one of our retiree open enrollment health desk sessions. We will be available to answer your questions live. Since this is our busiest time of year and we're a two-person team, we encourage you to attend one of our help desk sessions for general questions. To register for a session, click on the link. You don't need to attend every session, but at least attend one of the sessions if you have questions. If you have more of a complex issue or question about open enrollment, or you're in the middle of treatment or planning to change plans and you need transition of care assistance, we want you to contact the health plan directly. Conclusion and final reminders. Finally, we would like to remind you to read your open enrollment booklet. Read it from cover to cover and make note of any changes or benefit enhancements. Review the pre-recorded presentations and materials that we have available. Make sure if you make a change that you confirm your changes and you receive a confirmation. If you're not making any changes, you don't need to do anything. If you're changing to a Medicare plan, make sure you complete your Medicare form and have those submitted by November 25th. That's your Medicare forms deadline, not the open enrollment deadline. So again, if you're changing to another Medicare plan, make sure you complete the Medicare form and get that submitted to the RAS by November 25th. Again, if you're satisfied with your current health plan options, you're not required to do anything, but we highly suggest that you review the open enrollment information. If you add a family member, expect to receive a letter from Unified HR in the month of February requesting documentation to verify that family member. If you change plans, look for your ID card again the first week of January. Be sure to file your old card away in a safe place just in case you need to refer back to it at a later date. Again, open enrollment ends Friday, November 22nd at 5:00 p.m., and this is a firm deadline. That concludes our open enrollment presentation for this year.